Of us was that people that were selected be Chicanos that had all played a role in the Chicano movement in their respective states, because this was a national program and we picked students from around the country, not just Colorado. Obviously, I think maybe there were 3 or 4 from Colorado, nada más. But this was an important program for the movement, and its success was very important, and so there was no doubt I needed to be a part of that. So it was in 1991, we were in Pueblo, and the opportunity to come to Salud lent itself. And I thought about it, and I really thought it was a really good idea, just because being a product of the movement and being engaged in social change, what has always been important to me has been the idea of increasing my sphere of influence. Not for me individually, but for the message. I consider myself nothing but a messenger for a movement in terms of social justice and equality and health care for all. And that's been my expression as a product of the movement in terms of what I've done. So the larger that sphere of influence, the more lives, the more people, the larger the impact one will have. And I realized that coming to Salud was a much larger system than what we had in Pueblo. The director at that time, Jerry Brasher, had gone to Pueblo in, I don't know, October, November, and made me a deal that I couldn't refuse, to come and be the medical director of his exciting Salud Health Center system here. And it was a different day and age, and the challenge was there, the opportunity to increase that sphere of influence, and there were a lot more patients that we were talking about. So it was a challenge that I was happy to take on and be a part of.
Well, I was kind of looking for somebody, and I happened to be talking one day with Dr. Mark Babbitts from the regional office, the physician at the regional office, and in Denver. And so he said that you better look at Dr. Lacona. Anyway, I got to thinking about it, and I said, I want to see if I can talk you into it.
I had done my residency in Fargo, so I was very used to managed care and what that meant, because Minnesota was the cradle of the managed care movement in this country. And I had seen hospitals buy up every private practice within a 100-mile radius of Fargo when I was a resident. That, was retarded in Colorado by 10 or 15 years. So what I had seen earlier was just starting to come to Colorado in the first phase. And that phase didn't take very well. But one of the things that health centers realized was that we had Medicaid patients. In those days, over half our patients were uninsured, and our insured patient was a Medicaid patient. And about 20-25% of our patients had Medicaid. And we realized that managed care would come to Colorado, that they would somehow develop, and if we weren't careful, they would be in control of our Medicaid patients, and we would be what we in those days called bottom feeders. We did not want that to happen. In 93 in Pueblo, at a meeting of the community health centers statewide, we made a decision that we wanted to form our own HMO and our own group.
So the University Hospital provided the funds and some of the staffing and so on to develop Colorado Access. And they had a board of directors, I think it was 9-member board or something, and I was one of those members.
Now, those were big, bold decisions to make, and words easy to say, but it was going to be quite a task. And it took us 2 years, but in December of 1995, we had partnered with Denver Health, with the University Hospital, with the Children's Hospital, and with 13 migrant and community health centers. And we formed our own Medicaid HMO called Colorado Access. We had hired someone to be the medical director in November of '95, and we went live. We started taking patients in December. He called 2 weeks into the job from an airport in Chicago and resigned. It was a lot more work than he had envisioned. We weren't sure what was going to happen because we had gone live and we didn't have a medical director. I made the move at that time to become the medical director of Colorado Access, understanding that I would have to take a leave of absence from Salud in order to do that, but also understanding that we needed strong leadership in that position, and we had no time to be looking for someone else and try and get them trained to do the job. All of this, why? Because I'm a product of the movement. I'm a product of the Chicano movement of the late 60s and early 70s, and I've been able to focus my efforts within the healthcare arena to push forth those ideals that we had of the Chicano movement of improving the living status of our population, our communities, and fighting for justice, fighting for equality, fighting for those things that we think each one of us deserves just because we're human beings and we breathe air, we're on this planet, and we're in this together. I'm proud to say that I can hold my head high because that's what's driven me, that's what's motivated me, and that is what has guided my thinking throughout my adult professional life. It's not something that I held on to as a young radical hothead and let go of when I got uncomfortable with it or got a certain level of education. I've never parted with my ideals, and I've never parted with the need for me to look at myself as a public servant, someone here to care for my community, because I said early on in my life that that's what I was going to do. If we can teach the ideals of justice, of equality, of being egalitarian, that's why we started the movement. That's what it was all about. And we must continue that, whether it is I, or now in this particular case, I handing off the torch to that next generation or generations, and realizing that if each of us makes his or her contribution, we will be successful. We'll be successful as a people, we'll be successful as an individual, we'll be successful as a movement.
I remember when I was at Valdez Elementary and I was running a school-based clinic for Denver Health there, and within 3 months of being there, a principal came into the clinic and she says, "You know what?" She said, "I just left a 3rd grade classroom and all the girls, most of the girls in the classroom said they wanted to be a pediatrician." She said, "Before you came along, most of them would talk about being a secretary or a teacher. Hopefully, you know, Dr. Lincona and my story and other people's stories will be able to help recruit young people into a health profession, because it's been a really, really great experience."
I am almost done with my pre-medicine program. I have 1 more year left. What's next is to apply and get into medical school, which is another 4 years. And depending on what I specialize, it'll be a few years after that. So if anyone were to come up to me and say, what do I expect? When I want to go into the medical field, I want to go into the healthcare, you know, what do I need to know? Tell me. And I mean, I'm going to tell them what no one told me, you know, which is you're going to have to work hard, harder than you have ever worked before. You're going to struggle so much, and you're going to go through a bunch of challenges that you think that it's going to be the end of it. And no, I mean, it's not. There's going to be times where you're going to be discriminated against for not completely knowing English all the way, I guess you could say, or just because of the language barriers, you know, or because you're a Latina or Latino, Mexican American or whatever, and they're going to look at you like they did me. Like, I've had more than I could count experiences where, oh, you're going to be you're wanting to be a doctor? Why? Like, are you sure that's where you want to go? Or, there's not a lot of women that's there, right? There's not a lot of Hispanics or Latinos or Mexicans that go into that field, where they doubt me. They doubt what I can do. And those are kind of big punches in the face, I guess, or into your pride and determination. But you just gotta take them as they come. And it's gonna be difficult, but you have to stay persistent, determined, and be committed to what you're going to do.